to introduce you guys to our lovely my lovely co-host today. So I have Neil with Sciton. We're so excited to have him here. He is a laser guru, and he is going to share a little bit about the technology that Sciton offers with BBL and Forever Young BBL. So we're very excited about this. And then we also have the lovely Stacy Martin, who is a licensed medical esthetician at Pflugerville, and then Amy Johnson, who is also a licensed medical esthetician at Pflugerville. And these ladies are beyond fabulous. They have great aesthetic backgrounds and are super excited to be here and share some information with you about photofacials. Just before I toss it over to Neil, I did want to say that we have invited some people here that may not have access to BBL specifically, but there is some of the information here that will be relevant to you guys in regards to photofacials. So don't think that just because where you're going doesn't exactly have BBL or Sciton photofacials that you aren't going to be able to take advantage of some of the benefits of this. So I'm going to hand it over to Neil now, who's going to talk a bit about the technology and BBL and Forever Young BBL.
Cool. Thanks, Taylor. Appreciate the introduction. We'll go ahead and get started. Like Taylor said, my name is Neil Angel. I'm with Sciton, and I am the rep for Sonova Dermatology. So over the next couple of days, we're going to be talking about some of our laser and light treatments that Sonova offers at their locations, one of which is going to be Halo. The other one is our Forever Young BBL. And we're going to talk a little bit about the differences of each and kind of how they work individually, and then also, how they work together to really enhance the results of patients. So, but today we're really going to focus more on the Forever Young BBL and what does it mean to be forever young? So, we all age in our own way. Some of us just do it a little bit better than others. These, Meg Ryan, Mick Jagger, Val Kilmer, these beautiful people when they were young, and they have not quite aged the same way. And a lot of times patients think like, man, these people are famous. They have all the money and access to everything in the world. Like if I do aesthetic treatments, I'm going to end up like this. And that's just not the case. The treatments we're talking about today are laser and light based. And what those types of treatments do is just create little tiny injuries into the skin. And then they let your body do all of the work. So it's just, enacting your body's own natural healing process. So the results are very, very natural, and a lot less like this that you see here, especially with poor Meg Ryan. So we'll go ahead and get started here. So this is BBL. So BBL stands for broadband light. And what it does is it pulses just this visible spectrum of light. Very safe light. It's not UV light. It's the same white light that you guys see in your rooms right now, but we just use certain wavelengths. We filter out certain wavelengths that we want to use that are highly absorbed in different discolorations of the skin. So, we can use wavelengths that are highly absorbed in pigment, for instance, like this patient, and really target the pigment and sun damage. And you can see here, this patient doesn't have a lot of textural issues, not a lot of fine lines, wrinkles, but there is a lot of sun damage. And just by removing those brown spots, you can see just how much more youthful she looks here on the right-hand side. And this is just 2 treatments. So 2 weeks post 2 treatments. So, pigment is one of those things that makes a huge difference when you can kind of get rid of some of the sun damage. And it's kind of the easier of the things to hit. It's the low-hanging fruit. So a lot of times, with Forever Young BBL, it's one of the most instant gratification treatments in aesthetics because you see this working and you see it respond. And, there's no question afterwards, like, oh, did I get a result? Did I not achieve a result? This is another great example too. So this patient didn't have quite as many, as much sun damage and brown spots and stuff like that. But you can see on the right, like these spots are gone, but just look how much brighter and evened out her skin tone is. And that's the other component to Forever Young BBL is, when you do these treatments at Sonova, they're not just going to go in here like, a lot of places and just zap these brown spots. They're going to do a global treatment over the entire face to help with some reds, help with some browns, and just brighten and even out the skin tone. They always start with a couple base passes that helps, produce some collagen and elastin and plump up the skin, helps brighten the skin. And then they do these therapeutic passes that target more of this discoloration, whether it's, browns or reds or a combination of both. This is a guy here, he's got some rosacea, he's got some telangiectasias and facial vessels and things like that. So this was 5 treatments. And one of the nice things for redness, if you stack, 4 or 5 treatments together over a, 2-4 weeks apart, you can really help keep this redness and rosacea in remission, kind of keep it at bay, and then maybe do a maintenance one every 6 months. But it's amazing for diffuse redness. It does an amazing job for that. So this is another good one here. This guy, he's got these facial vessels, little telangiectasias, things like that. And honestly, he was probably coming in. His wife probably booked him an appointment. He could probably care less about this stuff, but she's like, there's some laser that we can get rid of the red, vessels. And he's like, sure, fine, I'll do it. But you could see it's not just about the red vessels and, treating those, which on the right-hand side, those are gone. But look how much brighter and healthier his skin looks. And that's really the difference with this Forever Young BBL is, if he'd have gone in for an IPL treatment, they'd have gone in, they would have hit those vessels and he'd have been gone. But, it's much more than that. It's about, just how much brighter and healthier you can make the skin when, and there's been studies that show, and we'll talk a little bit about some of those, and just, the long-term benefit of this pulse light and this heat, reinvigorating those skin cells and causing your body to start producing collagen and elastin again. So it's another patient. She's got a combination of some reds and browns. And so, they're able to easily treat, both of those conditions in one treatment by just changing out different filters. So. And then, the great thing with BBL is you can do it all over the body. So, a lot of times patients start on their face and then they realize their neck doesn't match or their décolleté doesn't match. And then, they just work their way down. And, the more of this stuff you pull off, just the more youthful and healthy the skin looks. We're not born with a lot of this stuff. I have freckles, things like that, but, I wasn't covered in these things whenever I was born. I just accumulated them when I was older. And I don't know if you can see, like I did a split arm treatment. So this was my left arm here and then the right arm, and just really cleaned up just years and years of that accumulated sun damage. And so
That's crazy. I definitely I agree with you, Neil. We had a oh my gosh, that's crazy. We had a patient that came into the office who was in the same situation as you, where we were like, oh, it's just freckles, and then you watch them treat it, and then to be able to see how like much brighter and clear the skin is after having the treatment is amazing.
it is. It really is. And there's studies that show that, like, that's one of the things that our eyeballs are drawn to. They see those spots, and it's, if you can remove those out, and they kind of give away your age. You think about a newborn baby, they don't have all of that. And so their skin's just really plump and it's even and it's bright and healthy. And so, that's one of the big things, even more so than wrinkles. Like, people notice spots and discoloration more so than texture. So, and this is the healing process, and this is kind of that instant gratification part of BBL that we were talking about, is you can see it working. So this is the before photo, and then this is this patient 3 or 4 days later. And so what happens is all of this pigment darkens up, and then your body pushes it up to the surface, and then it just flakes off. And you can see here, most of those spots are gone. You can see here in the middle right here that those spots didn't quite respond. And so they're a little bit left over. And so that's usually why they recommend, doing these in a series. You're going to get a lot of the low hanging fruit in the first treatment. But then what they do is with their second and third treatment, they come in and they clean up the rest of it. So the next component is, once you get your skin back to where you want it to be, once you get corrected and you're here for, say, it becomes, how do we keep our skin looking like that for as long as possible? And so we had some dermatologists, Dr. Patrick Bitter did a study out in Stanford. It's a 10-year study, 500 patients that did multiple BBL treatments a year for over a 10-year period. And they looked at their before and after photos. And in every single case, these patients who had did 2 to 3 BBL treatments a year for that 10-year period, their skin looked younger, healthier, and shinier 10 years later than it did prior to them starting the treatments, which is, not the case normally, right? We age the other direction. So, by constantly exposing your skin to this heat and to this light, keeps those skin cells reinvigorated, keeps them producing collagen and elastin, because those things go dormant as we age. And so, as patients become 40 and over, those skin cells tend to turn off and they don't react and respond like youthful skin cells anymore. And that's why patients lose laxity and volume in their face. And so this is just one of the really good treatments that you can do in aesthetics to reinvigorate those things, keep them active, keep them producing collagen and elastin, and just slow down the aging process of the skin. This is Dr. Patrick Bitter. This is one of the dermatologists who did the study. This is his forehead at age 43. This is his skin at age 55. And really, if you talk to Dr. Bitter, the only thing he does is really, these BBL treatments and Botox. And the two complement each other very, very well. So both of them, have really good, maintenance and preventative effects to them. So, and this was part of this gene expression study. So, these patients that were in the study, they biopsied them and they looked at their genes and they compared them to younger patients who had never received any laser or light treatment and older patients who had never received any laser or light treatment. And the section over here in this young untreated group that's yellow, these are the genes that are on when we're young that turn off when we age. And you can see it here in this aged untreated, those things are off. And so these older patients who did the 2 to 3 BBL treatments a year for that 10-year period, the genes that were off in their peers were actually on and resembled more of that of these younger patients. So, I mean, this is all, backed by, some really, great programs and physicians across the country. They compare it a lot of times. I've heard it compared on some of the, podiums, is that it's similar to the photosynthesis process, right? Lights do better when they're exposed to light and heat. They're healthier, they're shinier, they respond better, and kind of similar to your skin. And so that's kind of going into the BBL and the Forever Young BBL process. Tomorrow we're going to talk on Halo, and Halo is a resurfacing laser that really focuses on texture. And you could see here, this lady had a BBL treatment and her brown spots are gone, but that probably wasn't the best treatment for her, right? Because there's a lot of textural issues that are also going on. And, this is one of the things that when you go to a practice like Sonova Dermatology, that they're going to sit there and they're going to do that consultation and they're going to be able to find the right treatment that's best for you. And maybe, doing something like a Halo first can help jumpstart your skin where you want it to be. And then you get you on a maintenance program with the BBL, or maybe doing a Halo BBL combination just really enhances your results from right off the bat. And then, again, you maintain with the Forever Young BBL. So please join us tomorrow. It's from 12 to 1 again. Like we said, we'll be going a lot more into Halo, and then we'll also talk about, just how great that combination therapy is. So what I'll do is I'll turn it over to Stacy and Amy. And
hello. I don't know if you guys can hear me.
We can.
Okay, perfect.
So I just wanted to thank Neil, and he'll be here with us still, but thank you so much for sharing that information with us. Just to kind of recap what he talked about, just because we had a few people jump on a little bit later, and then I'll throw it back to you, Stacey. Sorry, I'm stealing the spotlight.
No worries.
Is that basically what this laser treatment is, a light treatment, and what it's doing is basically drawing that pigment to the surface. It targets it and draws it to the surface, and then it sloughs off the face, which you could see in some of those results, where those things that looked kind of like it was either sun damage or looked kind of like freckles, but they weren't really freckles, kind of darkened and then were brought to the surface and then kind of fell off. And then we talked about how Forever Young BBL offers the ability to kind of make your skin mimic younger skin. And then he actually showed some results where when patients had been treated consistently over time, that their skin actually looked younger, which is beyond amazing. Definitely a great way to look at this is kind of like BBL is like your treatment where you're treating just the pigment, and you will see a brightening result, which he's showing here. These results are phenomenal. I mean, those telangiectasias and the little veins and the redness, you can see how it clears it up. But the Forever Young BBL is kind of like an overall rejuvenation procedure, which kind of helps the skin deeper than just the surface. So I did want to ask Stacy, who is one of our licensed medical estheticians who does BBL regularly with her patients and sees amazing results. What would you say is an ideal candidate for this kind of procedure, Stacy?
Ideal candidate really is your almost just about anyone. I mean, you really wouldn't want to be too dark pigmented just because that's usually why we do offer a free cosmetic consultation just to make sure that you are the right candidate for the treatment. But most people can benefit from the photofacial. You just don't want to be, too dark or too tan, just because all the laser really knows is pigment. So it'll have a harder time kind of deciding, what am I looking for here?
That's great. I have a question for you, which I think is a really valid question. So does this treatment apply to different areas of the body? I know we talked a little bit about the décolletage or the décolleté, depending on how fancy you are, in the face.
Yeah,
and Neil talked a bit about his arm. So tell us about kind of other areas that you've seen treated.
Well, hands are very, very popular. They respond really, really well to treatment. Hands, arms, chest, neck, and face, probably definitely the most popular. I have done legs before. Those are a little bit trickier, but can totally be done.
That's awesome. And then let's see here. What about like the back and the shoulders area? Basically anywhere on the skin can be treated, correct?
Right. Mostly your pretty sun exposed areas can usually be targeted, yes, with the photofacial.
That's awesome. And so Neil did talk about how a series of treatments is usually the best way to go about this to see optimal results. About how many treatments do you typically do per patient?
Usually we do a package of 3. Sometimes we do a package of 5, just kind of depending on, the person that's wanting the treatment done, what kind of fits their lifestyle. Sometimes if it's rosacea, we might need a couple more treatments than, somebody that might just have some brown freckles going on. So a lot of times that's why we, refer back to the free consultation to kind of decide, what would be the best treatment for you.
For sure. I definitely agree. And I've reiterated this. And if you've been to any of our webinars, I say this endlessly about how great I think a customized consultation with one of our excellent providers is, whether it be a doctor, a PA, or one of our licensed medical estheticians, because they can see what you are looking to achieve and help you target those things with a variety of different procedures, which can include BBL, Forever Young BBL, and or Halo resurfacing, depending on where you're being treated. I do have a question here about utilizing a chemical peel with a BBL. Do you have any familiarity with when you would suggest doing that? Would you choose to do one before the other?
Not really. I mean, it usually just depends on the skin, or I'll talk to the patient and kind of see like what's going on with their life, because sometimes when you do a peel, there's a little bit more downtime that goes along with that as opposed to a photofacial. With photofacial, there's no downtime. I mean, you can leave the appointment, go to your car, and put makeup on. So where with chemical peel, that may just not be the right thing for you right now. So I don't think that there's really like, oh, I have to do chemical peel first and then do my photofacial second.
Okay.
You can kind of just play around with it.
Great. Thanks for answering that question. I got a couple of those. And then I've got another one here. So and this may be something that Neil can help answer as well, will a BBL photofacial or a Forever Young BBL address white spots on the skin?
No, it's not going to address the hypopigmented spots. Is that what you're talking about?
Correct.
Right. No, it's not going to really affect those. It will make the surrounding skin around that kind of balance out a little bit nicer to maybe where those white spots aren't as noticeable, just because the complexion will look a lot more clearer. But it's not really like it brings the white spot up to the surface like a brown spot.
Gotcha. So more targeted for browns and reds, it sounds like.
Exactly. That's all it knows is pigment. So
Perfect. Yeah, so it targets that. That's a great question.
It is a good one.
And I have a question here. Does BBL or Halo address acne scarring?
Yeah, so that would be more of a halo type treatment. Now, if you have those red inflammation kind of scars, the color part of the acne scarring, you can hit those with BBL. And sometimes they'll do a combination of treatments when they're doing acne scars. So do BBL for those for the color, and then do halo to try to, punch tiny little holes into those acne scars and try to get them to remodel more evenly and fill in those holes from underneath. So uh, it would be more of a halo thing. And I know that's something that we were talking with Dr. Hansen and Dr. Marmalak about recently, and even some other, laser resurfacing options that could be great for acne scarring. So they have a lot of tools at their disposal at Sonova, and that's kind of the really nice thing when you're working with, a really established practice like that, they can find the right tool for the job.
Yeah, I have another great question, and this may be one of those things where a consultation is just necessary, but I have rosacea and a couple of dark spots. Do I need Forever Young or just a BBL?
Yeah, it'd probably be, I mean, you want to do a series. It'd probably be, a corrective package of 3 to 4 to really make sure that they address the redness and also get rid of all of the sun damage. And then, the Forever Young BBL is more of the ongoing maintenance side. So that helps clean up any new spots that you may pick up along the way, after the summertime and going out to the lake and et cetera. And then also too, this isn't a cure for rosacea. So, those things can come back. But, what we've seen with rosacea is if patients stick to a regimen of like 3 or 4 of these a year, you can really keep it in kind of remission and at bay. And so
That's great. Yeah, I love that. I love the idea of like getting your like kind of treating the immediate concern, which would be more the brown spots or the reds, the telangiectasias, the little veins, and then going on to your Forever Young and doing that as your maintenance. Because I know that one of the questions that I would have is, once I come in and I say I get my series of 3 BBL treatments to kind of address the uneven pigment or the dark spots that I have from sun damage, am I good forever, or is it something that could come back?
yeah, I mean, it definitely can come back, right? We're going to get rid of those spots that are there. But, if a patient goes right back out into the sun and without sunscreen or wearing hats or cover ups, and, they can definitely pick up new pigmented spots. So that's, and this is, so, we know the effects of the sun and how damaging it can be to our skin. But, there's also something to the vitamin D effect that it, makes people feel good. And you all are based in Austin and there's plenty of outdoor activities, and, we want people to live their life. It's just, when you do pick up those new spots, that's the benefit of having these maintenance packages is you come in, they clean up, that's why in September, October, November, that's really popular times for these photofacial treatments, because everybody's going out on vacation and the beach and to the lake during the sun. And they can come in September and October and really clean up like any of the new spots they picked up along the way.
Yeah, I think that's a great thing to mention too, is like we're kind of smack dab in the middle of laser season, which I know this year is a little bit unique compared to previous years. So we're giving a little bit of grace to everybody. But I do know myself personally, I did find a little bit of excitement in going out and hiking, or, going to the pool and kind of keeping my social distancing, or going on walks just to get out of the house, because we are trying to stay in as much as possible. So I'm not, just because we're more at home than we have been previously, doesn't mean we're not experiencing the sun. I mean, even through the windows here, you can get sun damage from prolonged exposure. So I definitely think it's a great time, especially with being at home. I mean, not everyone is getting together for Thanksgiving this year potentially. So I mean, maybe it's a great time to try out one of these procedures and take advantage of the time that you're not going to be face to face with people. Which, as Stacy said, you don't typically look that bad after you've had it done. It just kind of looks like a little bit of darkening of those spots. So it just looks kind of like little dark freckles on the skin. But if that's a concern of yours, maybe it's a great time to test one of these things out. Um, let's see here. I think I had one more question. I had one, best treatment for lines. I'm 71. And from what I've heard from you, Neil and Stacy, is kind of like if you have pigment issues, a great thing to do is maybe start with BBL and kind of address those, and then move on to halo, or would you suggest back the opposite direction?
Yeah, I think if the concern is more fine lines and wrinkles and texture, then I would start with a halo or maybe even a combination treatment of both. But halo is a resurfacing laser, and we'll talk about it a bit tomorrow. But what it does is it uses some heat to remove very thin layers of the skin, and it just, you kind of peel away this older, damaged skin, and this smoother, newer, healthier skin is revealed from underneath. And so, it's going to do a much more immediate job of helping with that texture, fine lines, wrinkles. Now, if you see in like some of these forever young BBL photos, there are textural improvements with BBL. It's just more over time. So, if it's the case where you really want to focus on that and get to that point quicker, usually that would be a halo treatment. And there's also Dr. Mumlak does some CO2 resurfacing and things like that. And so, that could even be an option depending on, how much downtime the patient's willing to give up.
Yeah, that's perfect. Thank you so much for answering that question. I'm going to give people just another quick second here to ask any additional questions that they may have, but I am